Today, we're going behind the curtain on how modern doctors get their start. And let me tell you, it's not all lecture halls and textbooks. It's more like a high-stakes mission where the next generation of physicians learns to save lives by first treating patients who aren't even real. I mean, think about it for a second. How do you actually train someone to be a medical detective, to solve a really complex mystery happening inside the human body before they ever lay hands on a real live patient? You need a training ground, right? A way to practice without any of the risk. And here's the answer. You give them a mission. They have to build a complete virtual patient from the ground up, diagnose what's wrong with them, and then present the entire case. It's basically a full-scale dress rehearsal for what they'll be doing for the rest of their lives. So let's get our bearings. This is way more than just another homework assignment. The whole thing is framed as a mission, and every student is an agent who's been tasked with cracking a very important case. So, welcome to Mission Control. Now, this isn't some solo flight where they're just thrown into the deep end. The entire mission is a fully supported operation. You've got the patron, Dr. D.K. Verma, at the very top, but then you also have faculty mentors and even what they call ground control staff. Every student has a full team backing them up. Every mission needs two things: clear objectives and the right gear. So let's take a look at the core skills these students are supposed to master and the seriously high-tech toolkit they get to use. The mission boils down to four main goals. First, clinical reasoning. That's the actual detective work. Then there's patient-centered care, which is all about remembering there's a human being behind all that data. Third is something called the physiological bridge, connecting the science to the symptoms. And finally, digital fluency, because you gotta know how to use the modern tools of the trade. You know, this quote right here about clinical reasoning, it really gets to the absolute heart of the mission. It's all about making that jump from just knowing stuff out of a textbook to actually using that knowledge to solve a real puzzle. It's the difference between knowing facts and thinking like a doctor. And this is the cool gear they get to use. Their main command center is a platform called Geeky Medics, but they also have this whole ecosystem of other tools, from detailed anatomy apps to AI simulators. This is exactly what that digital fluency objective we just mentioned is all about. Okay, so the mission's been briefed, the gear is ready, now let's see how it actually plays out. We're gonna follow a student as they kick off phase 1, creating the case file. This is where the mystery officially begins. So the first few steps are really structured. The student logs into Geeky Medics and uses it as their framework. Then they pick a common clinical problem to build their case around. You know, something like asthma or chest pain or dizziness. And from there, they have to follow a standard clinical workflow, just like they would in a real hospital. And this is where it starts to feel really real. They actually create a patient profile. This isn't just some abstract concept. It becomes RK, a 19-year-old male student. And then they define the chief complaint in the patient's own words: shortness of breath for 3 days. That simple sentence, that's the first clue. From that one single clue, the whole investigation just blossoms. The student starts building out the full story, gathering all the details on the present illness, like when did it start, what makes it worse, and they also dig into the patient's broader life context, past medical issues, family history, lifestyle. They're basically assembling a complete intel file on their patient. All right, the patient's story is now on paper. The mission is entering its most critical phase. Now it's time to sift through all that evidence and actually start figuring out what's going on. This is the real detective work. So here's where they pivot from just gathering information to actually forming hypotheses. They collect all the virtual examination data, pulse, blood pressure, you name it. Then, using all their logic, they have to propose a primary diagnosis. But, and this is so important, they also have to come up with two other possibilities, what doctors call differential diagnoses. Now, before we get to the big reveal, we have to understand this one key idea: the physiological bridge. This is the why behind everything. It's not enough to just name a disease. You have to explain the scientific link between what's happening deep inside the body and the symptom that a patient actually feels. It's the bridge between the textbook and the person. And boom, this is that bridge in action. This is the aha moment. See, it's not good enough to just say asthma causes a wheeze. The student has to explain the entire chain of events, how asthma causes the airways to constrict, which leads to turbulent airflow, which is what creates the sound we hear as a wheeze. This is how they prove they get the mechanism, not just the symptom. So, the case is cracked. The connections have been made.
Now it's time for the final part of the mission, the debrief. This is where the student has to package up all their findings, reflect on what they learned, and submit everything for review. And this final report is way more than just a summary. The students have to really think about their learning process, put their findings into a professional presentation with charts and diagrams, and of course, cite all their sources. It's the final step that wraps up the whole investigation. So, how is a successful mission measured? Well, check this out. The virtual patient case itself, that's half the grade. But look at the rest. It's split evenly between the quality of the science, how well they used the digital tools, and how clearly they presented it all. It's a total evaluation of all their skills. Oh, and one more thing. There's a deadline. This whole complex mission has to be done and dusted in a tight 10-day window. And why the pressure? Because medicine doesn't wait. It's a mandatory high-stakes drill that mimics the real world, where time is always a factor. And for those who really knock it out of the park, the rewards are bigger than just a good grade. The best projects get showcased in the department and even get institutional recognition. Like their AI assistant Dristy says, this single assignment is literally the foundation of your medical journey. So we'll leave you with this to chew on. The next time you meet a doctor, just remember that they started out like this, as a student detective solving a virtual mystery. And it really makes you wonder, doesn't it? How many virtual lives did they have to understand, diagnose, and ultimately save, just so they could learn how to one day save yours?